All right, let's dive into the incredibly high stakes, high failure world of creating new medicines. It's a place where, brilliant science often just hits a dead end, and a promising cure can suddenly and dangerously turn toxic. But what if there was a hidden map to navigate this minefield? Well, let's find out. So, this is the central mystery, right? Researchers will design a molecule that looks perfect on paper. It's like a silver bullet, targeting a disease with pinpoint precision. But then, when it actually hits the lab, bam, it has all these unexpected, sometimes even lethal side effects. This whole problem of drug toxicity, it's the wall that derails countless promising medicines. So the question is, how do we break through it? And this is where our story really begins. There was a team of researchers wrestling with this exact problem, and they found themselves completely trapped. But their escape hatch wasn't some fancier piece of code or more powerful computer. No, it was the discovery of a fundamental rule about how toxicity actually works in the first place. A discovery that would literally change everything. To really get their breakthrough, first we have to understand the crisis they were in. I mean, they had this state-of-the-art AI system designed to invent new drugs, but it was completely and utterly stuck in what they called the generative death loop. And trust me, it was a nightmare. Okay, so picture this loop. It's just sheer futility. Their AI would propose a brand new molecule. Then, a second AI, their safety oracle, would predict if it was safe. But every time they tested it in the real world, the molecule would fail. Time and time and time again. The system was just churning out chemical gibberish, and the entire research pipeline was paralyzed. I mean, this quote from the research team just captures their despair perfectly, doesn't it? Their own powerful tools had built them a prison. The generative AI was too wild to create anything usable, and their safety models were so conservative they just rejected everything. They were stuck, completely paralyzed, generating nothing and approving nothing. And then something shifted. As one researcher was sifting through these absolute mountains of failure data, a pattern started to emerge from all the chaos. It wasn't random at all. There was this faint but consistent rhythm in the way the drugs were failing. This was the first clue, a sign that there might be a hidden order to all the chaos. And that clue came down to this one magic number, 68. See, as they plotted a drug's toxicity against the number of unintended biological targets it hit, what they call off-target hits, they saw something amazing. The risk didn't just climb forever. It started to plateau, and it did so right around 68 hits. This single number was the key that started to unlock the entire puzzle. So here's the crucial point, what this all means. Toxicity wasn't just infinite chaos. It actually behaved like a math problem. Each off-target hit added a tiny bit of risk, but only up to a point. Once a drug hit that saturation threshold of about 68 targets, it was basically maxed out on risk. Hitting a 69th or a 70th target didn't make it any more dangerous. This was a physical law of biology, hiding in plain sight in their data. And this chart just illustrates the implication brilliantly. For drugs with fewer than 68 off-target hits, these specific little flaws in their chemical structure, they're known as motifs, were a huge predictor of toxicity. But now, look at that second bar. For the hyperpromiscuous drugs with more than 68 hits, those exact same structural flaws, they became completely irrelevant. The massive off-target promiscuity was the only game in town. But, even with this massive clue, the path to a solution wasn't a straight line. Like in any good detective story, the team got sidetracked by some very tempting but ultimately very wrong suspects. Their first major detour was what you could call the great algorithm debate. They spent a huge amount of time pitting two types of AI against each other. You had reinforcement learning, the bold explorer, finding all these new ideas but often getting lost. And then you had genetic algorithms, the careful exploiters, great at perfecting existing ideas but never discovering anything new. They thought picking a winner was the key, but it was a total distraction from the real problem. The second red herring, well, it was even more seductive. It was this elegant, mathematically pristine safety model called conformal prediction. On paper, it looked like the perfect tool to manage risk and give them confidence in their safety predictions. In reality, it was a complete and total dead end. Okay, let's break down why this is so important. The goal was simple, have a 95% confidence level about a drug's safety. But the model was so ridiculously cautious, the safety intervals it produced were enormous. Imagine a weather forecast telling you there's a 95% chance the temperature tomorrow will be between -50 and +50 degrees. I mean, it's technically correct, but it's completely useless for planning your day. The model was so paranoid, it approved 0 compounds, paralyzing the whole system all over again.
So, what do you do when elegant theory fails so spectacularly? You get back to basics. The team abandoned all the complex, impractical models and embraced a strategy of brutal, data-driven simplification. This was the real turning point of their journey, where they stopped chasing some theoretical perfection and started focusing on what actually worked.
And this slide just says it all. I mean, look at the stark difference. The elegant theory conformal prediction was pure, complex, and found 0% of the safe drugs. The simple tool, which was just a grid based on what they'd actually observed in their data, found nearly 93% of them. It was just a stunning victory for pragmatism over theoretical purity.
And this is what that brilliantly simple tool actually looked like. They just created a 20 by 20 grid. On one axis, they plotted the AI's predicted risk for a drug. On the other, they plotted how uncertain the AI was about its own prediction. Then they just looked at the real-world lab results for each square on the grid. Any square where the real toxicity was low became an accept zone. It was such a simple, visual way to make a complex decision, and it just worked. The performance was just incredible. As you can see, the grid correctly identified almost 93% of all safe compounds. That's a huge, huge improvement. But here's what's even more crucial. It achieved this with 100% precision. That means not one single toxic drug was ever accidentally put in the safe pile. It was the reliable, effective safety filter they've been searching for all along. So, with a working safety filter and a much clearer picture of the problem, the team finally arrived at their final and most profound insight. They realized that they, and you could argue the entire field, had been focusing on the wrong problem. They were tuning the wrong part of the engine this whole time. And this right here is the core takeaway of the whole story. They had been obsessed with the optimizer, the clever algorithm that refines drug candidates, kind of like a car's engine. But the real problem, the true bottleneck, was the generator, the foundational model that proposes the molecules in the first place. That's the fuel source. And it doesn't matter how powerful your engine is if you're feeding it bad fuel. A brilliant optimizer just can't save a terrible starting idea. And so, armed with this complete picture, the team moved from a broken, paralyzed pipeline to an entirely new blueprint for drug discovery, a new map for navigating the territory of safe and effective medicines. They had finally found their way out of the maze. So here they are, the new laws of drug safety they uncovered. First, risk is additive and predictable. It's a math problem, not random chaos. Second, that risk hits a ceiling around 68 off-target hits. Third, simple, real-world data beats elegant theory every single time. Fourth, focus on the quality of your starting ideas, your generator, before you even worry about the optimizer. And finally, the chemical rules themselves aren't universal. They totally depend on the context, like whether a drug is below or above that 68 hit threshold.
You know, I think this final quote from the researchers just beautifully summarizes their entire journey. They stopped trying to force the data to fit their preconceived theories, and instead, they just started listening to what the data itself was trying to tell them. They just listened until all the noise and failure resolved into a clear, understandable harmony.
And that leaves us with a final and pretty provocative thought. This team found a hidden physical law of biology just by analyzing their failures. And it really makes you wonder, in medicine, in finance, in climate science, what other profound universal rules are just waiting to be discovered, hiding there in the quiet song of our data? What else are we missing?